Surgery. It's a massive event in anyone's life, right? But for something so important, a lot of us go into it, well, kind of blind. We put all our trust in the experts, which is good, but it doesn't mean we should be completely in the dark. So today, in this explainer, we're going to pull back that curtain and get into what you really need to understand before, during, and even after an operation.
Okay, picture this. You're in the doctor's office, and they drop the S word, surgery. What's the very first thing that pops into your head? If you're like pretty much everyone else, it's probably, Doc, is there any way I can avoid this? Do I have to do it? And look, that's a totally natural reaction. It comes from a place of fear, of uncertainty. But what if that's not the most powerful question you could be asking?
Here's the game plan for today. We're going to break this all down into 5 easy-to-digest parts. First, we'll talk about what to ask before surgery. Then we'll get into the nitty-gritty of the procedure itself and, of course, anesthesia. We'll even take a peek inside the operating room to see how the team works together. And finally, we'll tackle a really important topic: what your options are if things don't turn out the way you'd hoped.
All right, part 1. That super common question, can I avoid this? It really just boils down to a yes or a no. But the questions that truly empower you, they shift the whole conversation from if you need surgery to understanding why.
So this is the key right here. Instead of looking for that simple yes or no, you want to open up a real conversation. Asking, why do I need this, helps you actually get the diagnosis and the end goal. And asking, what are the alternatives? That makes sure you see the whole playing field. Maybe it's medication, maybe physical therapy, maybe something else entirely. This is how you go from being just a patient to being an active partner in your own healthcare.
Let's make this super clear with an example. Think about an older person with really bad knee pain. Now, knee replacement surgery is definitely an option, but is it the right one? Well, it totally depends on their life. If this person loves to travel, loves being active, but is just stuck because of the pain, then yeah, that surgery could be absolutely life-changing. But what if they're mostly confined to bed or have other serious health problems? The risks of a huge operation might be way bigger than any potential reward. The best choice is never one size fits all. It's always about what's right for your life.
Okay, so once you've really nailed down the why, the next step is to understand the what and the how. Because let me tell you, when it comes to surgery, the details matter a lot.
So, for instance, let's take a coronary artery bypass. The idea is pretty simple. The surgeon takes a blood vessel from somewhere else in your body to go around a blockage in your heart. Seems straightforward, right? But here's the detail you might not even think to ask about. Does it make a difference which blood vessel they use? Oh yeah, the answer is a huge yes.
This is where it gets really interesting. A surgeon can use an artery from your chest, or they can use a vein from your leg. Now, using an artery is harder and takes longer, but it often works better for a much longer time. It's just built to last. Using a vein is quicker and easier, but there's a higher chance it could get blocked again down the road. See, it's a classic trade-off, and a seemingly small detail that could have a massive impact on your health for years to come.
And of course, there's some other crucial prep work. You've got to be an open book. Tell your doctors about everything. Any chronic conditions like high blood pressure or diabetes, give them a complete list of every single medication you take. And don't be surprised by things like shaving the area or needing laxatives for certain surgeries. But here's the most important thing. Whatever you do, do not stop taking your regular medications for chronic conditions unless your doctor specifically tells you to. Keeping your body stable is a huge key to success.
All right, you get the surgery part, but what about the magic that keeps you from feeling any of it? That brings us to anesthesia, and the super important chat you need to have with your anesthesiologist before the big day. So at a high level, you can think of it in 2 main buckets. You've got spinal anesthesia, which is for anything on the lower half of your body, like a C-section or a knee operation. You're actually awake, but you're completely numb from the waist down. Then there's general anesthesia. This is for the big stuff: brain, heart, chest surgery. You're completely unconscious, and a machine is there helping you breathe. But even within spinal anesthesia, there are some key differences. A spinal is usually a single shot that works really fast. An epidural is injected in a slightly different spot. And here's the cool part. The anesthesiologist can leave a tiny flexible tube in place. Why does that matter? It means they can give you continuous pain relief long after the surgery is over. It's a pretty big advantage.
Now we have to talk about risks. Look, any medical procedure has them, and it's good to be aware, even though these are all pretty rare. With spinal anesthesia, there's a chance your blood pressure could drop suddenly, or the numbness could creep up too high. With general anesthesia, one of the most critical moments is putting in the breathing tube. If there's a problem, it can affect your oxygen levels. And then there's a super rare genetic thing called malignant hyperthermia. where the body has a bad reaction and your temperature skyrockets. Your anesthesiology team is trained to handle every single one of these scenarios.
Okay, let's push open those doors and step inside the operating room. It's not just one surgeon working alone. It's a high-tech, highly coordinated space where every single person and every system is laser-focused on one thing: keeping you safe.
You ever wonder how they keep the air itself totally clean? It's genius, actually. Most operating rooms use something called positive pressure. It just means the air pressure inside the room is a tiny bit higher than outside. So, anytime a door opens, clean, filtered air flows out, literally pushing germs and dust away from you in the sterile area. It's like an invisible force field.
And at the center of it all is the team. You've got the main surgeon, of course, and their assistant, but then you have two incredibly important nurses. The scrub nurse is all sterile, standing shoulder to shoulder with the surgeon, handing them instruments, sometimes before they even ask. Then you have the circulating nurse, who's like the mission controller of the room. They manage supplies, keep all the records, and connect the sterile team to the rest of the hospital. It's a beautifully coordinated dance.
If you want a perfect example of this teamwork, just look at the gauze count. Before the surgeon even makes the first incision, the nurses count every single piece of gauze. Then, right before they're ready to close you up, they count it all again. And if those numbers don't match, everything stops. The whole team pauses. So how do they find it? Well, most surgical gauze has a little thread in it that shows up on an X-ray. So if one's missing, a quick X-ray will find it right away. That is the level of detail that goes into keeping you safe.
And that brings us to our final section. And it's a tough one. What happens after surgery when things don't go as planned? Sometimes there are complications, or the result just isn't what everyone hoped for. It's a really difficult spot to be in, so it's important to know what you can do.
The first thing to get your head around is that a complication is, by definition, unexpected. But it's not impossible. No doctor ever wants this to happen. And if you went into that surgery having asked all the right questions and made a thoughtful, informed decision, then that decision was not wrong, even if the result isn't great. Beating yourself up and thinking, "I never should have done this," just makes a tough situation even harder. You made the best decision you could with the information you had.
So if you are unsatisfied, know that there's a clear path to follow. Step 1 is always to talk to your surgeon and the team. Ask them to explain what happened. If that doesn't resolve it, most hospitals have internal folks, like in social work or patient relations, who are there to help. The next step up would be filing a formal complaint with the local health department. And only as a very last resort, if nothing else works, should you consider the legal system. The point is, there is a process.
So when you boil it all down, it really comes back to one simple question. When you're facing surgery, you have a choice. Are you going to be a passive patient or an active partner? By asking why, by understanding the details, and by knowing who's on your team, you give yourself the power to make the best possible decisions for your own health. And that, right there, is the most important thing to understand about surgery.